one final health question for each of you. And do you think that the district's HIV prevention approach is adequate? And if not, how would you what kind of changes would you recommend or would like to see put in place? Mr. Page, you may start.
Well, DC Appleseed just came out with a report card on the district's HIV prevention record. There are a lot of A's and B's on there. Some grades have gone up, some grades have gone down in certain areas. It's a tough question. I mean, I think the idea of pushing an abstinence program component is attractive, but also we've dropped down on our grade, I believe, on condom distribution. I mean, obviously you've got people out here who are adults who are sexually active. They need to make sure that they have condom distribution. I believe we dropped down a grade on HIV awareness. Clearly, actually a somewhat horrifying story. I remember I was on the bus, on Metro bus, and I overheard an older gentleman telling a younger gentleman that you couldn't contract AIDS if you had sex while you were standing up. So, I mean, we still have a way to go as far as awareness and letting people know how serious this disease is, the way that it's transmitted, and things of that nature. We're going to have to also work with more off-the-box ideas. Again, the peer training idea is a beautiful concept. Metro Teen AIDS has done a lot of work. They need to be supported. They've done a lot of great work in the youth community. We have an increase in AIDS transmission in the older age brackets. That may also require some peer outreach as well. I think there are a lot of different things we can try, but we need to start looking at best practices around the country and around the world, and AIDS transmission reduction, and the reduction of the HIV transmission, and see what works all over the world, and start bringing those ideas home to the district. One thing we can do, I remember I just saw Kai Henderson speak. She mentioned basically commissioning case studies from the top 10 business schools in the country, so it's case competitions, pardon me. So these top 10 business schools, free of charge, got together, competed to try to figure out these solutions to complex education problems. We could do something like that on the HIV reduction strategies. And I think that.
I haven't seen the Appleseed report card, but that actually disturbs me. There were mostly A's and B's. I think that we have one of the highest rates of HIV in the country. We have an HIV rate that rivals third world countries. I think that the programs that you've seen the city throw money at, I'm going to say throw money at, are fly-by-night operations. They see a shift in the demographics of HIV, and they're just trying to guess how to stop it. And if you followed any of the cases of where we spent the money, where we gave these earmarks, where we put the federal dollars into, most of these nonprofits that popped up had no track record dealing with public health issues. And so in that sense, it's like I feel that we have failed everyone at every level. The public policy campaigns that have gone forward and all the PR campaigns that have reached out to communities continue to focus at a demographic that is the most educated around HIV/AIDS, which is homosexual men who are normally white. I see that they've brought out into color a little bit. So gay white men are the absolute most educated around HIV issues, and particularly those that are sort of between the ages of 25 and 45. Heterosexual women of color, Latin, African American, recent immigrants are the highest growing population of HIV, and none of the social programs that we're focusing on, all the PR campaigns, are geared towards them. It's almost as if the district has just given up. They're like, well, if it doesn't fit this one small specific hole of HIV awareness, we don't really know how to reach it. We can reach out to teenagers, we can reach out to gay white men, but we don't have any idea how to reach out to these other communities. And so in that sense, I think it's been an utter failure. I would really try to partner with places like Mary Center, because once you start getting women, if we're talking about maternal medicine, Columbia Health Services, the Shaw Family Collaborative, they deal with these folks at so many different levels that HIV awareness at those levels, particularly with people who are married, who are married and husbands stray, or people who've returned from penitentiaries. There's a huge element of people that are coming out with people with HIV that we're just not talking to.
I think there's tons of research and data that supports how poor a job this city has done historically with the HIV and AIDS prevention programs. I think it goes to the theme of the night that I've been promoting is oversight, accountability. Because all the dollars that have been wasted and thrown at these organizations, we trusted someone to go through research and make the decision that was in the best interest of the challenge of the HIV and AIDS prevention. Somebody dropped the ball. So we have to go back to a place where we as the citizens of this city get the steering wheel back and drive the issues and drive the solutions that matter most to our neighbors. I get so frustrated when I look at some of the other issues that get press and other things that get support, and we have people dying homeless with HIV and AIDS. We have people contracting it through pure ignorance because of the lack of proper targeting of demographics that most are in need of it. This speaks again to oversight and accountability. Either way you slice it, those are the kind of things that we have to make sure we're constantly putting out front. And it's going to be uncomfortable. It's not going to be popular with a lot of people, but it's in our best interest.